Bonjour.
Bonjour et bienvenue à cette conférence de presse concernant la campagne de vaccination contre la COVID-19 au Québec. Mon nom est Marjorie Côté-Boileau, attachée de presse du ministre de la Santé, Christian Dubé. Alors, pour la conférence de presse aujourd'hui...
For the press conference today, the Health Minister, Mr. Dubé, will do opening remarks, and afterwards, the Minister of Finance, the Minister of the Economy and Innovation, Mr. Éric Girard, will also make a speech. And Mr. Daniel Paré, who's Director of the Vaccination Campaign, will also be here to answer questions. Without further ado, Mr. Dubé. Thank you, Marjorie. Good morning, everybody. I'm very, very pleased to be here today with my colleague, who's the Minister of Finance and the Minister of the Economy and Innovation, as well as my colleague, Daniel Paré, who is leading the vaccination campaign with his team. There are several people here today from the vaccination team, and once again, I want to thank them for all of the work that's been done since the beginning of the campaign. But I am mainly pleased to present to you today a project on which we've been working for a few weeks in collaboration with Lotto Quebec, and that is what we will call Gagner à être vacciné. But before presenting the good news, I think it's important to take a few minutes before talking to you about the contest. I will let the good news to my Minister of Finance, but I want to talk about the emergency rooms in Quebec. Right now, we all know that the situation is very fragile, especially in the Outaouais region and in the Montérégie, but we feel it throughout Quebec, in Matane, etc. We've had some issues that we settled in Baie-Saint-Paul, but it's fragile throughout the province. And I wanted to reassure the population while we're here this morning to say that we are acting to take all means necessary to minimize the impact of the lack of staff. For example, I'll give you 3 examples. We have asked recently, in the last week, we've asked generalists to take on more patients, even those who have certain symptoms, COVID-19 symptoms. But there were some agreements during COVID-19, whereas we went through evaluation centers, and now we are settling this. And I appreciate the work that will be done by generalist doctors, because we do need to take care of the emergency rooms, and that filter is very important. We have also asked clinics, what we call our GMFs, the family medicine groups, to increase their opening hours, including at night and on the weekend, in order to come back to what we had pre-pandemic, to make sure that patients, when they have a problem, do not necessarily go to the emergency room. We want people to go back to the clinics. We've also asked our CEOs to reorient patients from emergency rooms to frontline services, to the clinics, as I've said, but also with our emergency system, which we call our pre-hospitalizations, so that we can send them to hospitals that have more capacity right now. I'm repeating myself. Of course, we won't be able to do miracles in the very short term. We can find some solutions. We've done it. We've found some solutions in a few places, but we must deal with the lack of staff in our network. For example, this summer, we're acting concretely over the short, medium, and long term, and we'll get back to you with more details on this in the next few weeks. But I want to end with this point by saying that I maintain what I have said. The staff needs to rest, and this principle of letting them take their vacation, all the nurses, they have to be able to take their vacation. It's well-deserved, and I wanted to provide this update today, and I'm certain that Quebecers understand that we still have a few difficult weeks ahead of us. Now, to come back to the good news. Well, gagner à être vacciné. In a few minutes, my colleague will give you the good news. It's always up to the finance minister to give the good news. When he comes up with a budget, he's always got good news, so we'll let him share the good news today as well. But the contest that we have created, and I want to say this, it is not only to reward those who are already vaccinated, but also those who will get vaccinated. Because what we want to encourage is vaccination for first and second doses. And so, in our objectives, and I've got 3 of them for this contest, one of the objectives is to move up appointments that were made for after the 1st of September. You'll remember that when we had the requirement from public health to give an interval of 16 weeks, there was approximately 3 million or 3.5 million appointments that were made after September 1st. Since we have changed the intervals, thanks to public health opinions, there are 600,000 of these appointments as of today. So it goes down every day because there's more than 3 million people who have changed their appointments. So we still have 600,000. Later, when Minister Girard will talk about the conditions of the contest, you'll remember that your 2 vaccines must be taken before the 31st of August. So my first objective is to accelerate and to ask people to move up their appointments before the 31st of August. The second objective, we also want to increase the number of first doses administered because it's very important. And I've been saying this for a few weeks now. We must reach the 75% in each one of the age categories. Right now, it's going quite well. We've got 82% total for the first dose. But in certain categories, and I've repeated this often, the 18 to 34-year-olds, we have approximately 80,000 people below the threshold in these 3 categories, or below the threshold of the 75%. So the second objective is to reach the 18 to 34-year-olds that we're missing so that we can have at least 75% of the population vaccinated in all of our age categories. And the third objective, with the variants, and now you'll recognize not just the Minister of Health, but the Minister of Finance, we always set our objectives a little bit higher because we want to succeed. And with the variants, I also want to say that, yes, we had set an objective initially of 75%. But given that we're now at 82%, and with variants, we can see, especially in Europe, the variants are more difficult. They have different factors. So every percentage that we will gain, every additional percentage of the target population, every point is worth 75,000 people. So we've got a bet internally to see what we're going to do with vaccination. But I would tell you that I'd be very pleased if we had a lot more than 82% of the population vaccinated once we do our draw. So finally, it's very important to have more than 75% in all age categories 12 and up who have received, who will get their 2 doses before the 31st of August. And for this, you know, you have an interval of 4 weeks between the 2 doses. So do your calculations. That means that the 31st of July or somewhere around there is your last chance to get your first dose so that you can then have your 2 doses administered before August 31st. We're good? Why are we doing all of this? I think it's important to mention it. We're doing all of this to avoid hospitalizations if cases start creeping up in the fall, because we have said this. The beauty of a rate of vaccination that's already at 82% for the first dose, and we hope to be able to have approximately the same thing for the second dose. We saw this in Europe, and you can see the examples. Once the 4th wave hits, or we'll call it an increase in cases. Countries where they're well vaccinated, there's an increase in cases, but there's not necessarily an increase in hospitalizations. And you'll remember, since the beginning of the pandemic, what we want to do is protect our healthcare system so that we can stop having interruptions in service and delaying of surgeries. And that's why we're doing all of this. And I'm repeating myself here. We want to come back to a certain normality, and we are doing this for our healthcare system. We do it for the education of our young people. We want to be able to open up all our schools in September in perfect conditions. And also, we do it for economic reasons. Everybody wants to come back to a normal life. So I have to talk about logistics. As of the 25th of July, that's next week, people will be able to go register for the contest by going on the portal. And the portal, there's a lot of people who already know it because there's more than 82 or 83% of people who were vaccinated who got their vaccine proof from this portal. So to get their QR code. So I invite you, as of the 25th of July, in order to participate in the contest, because that is how we will proceed, people will go register for the contest, go through the portal to register. However, as of now, you can register as of the 25th of July, but as of now, for those who are in the 12% who have not yet gone, go check to make sure that the information that is there is correct. And if you have any issues when it comes to registry, through the registration, we've improved the portal. Daniel and his team have a phone line in place with some people who can help you to settle all of your issues. And I'm certain that all of those who want to register as of the 25th of July will be able to register. We found all sorts of procedures. So once again, go register on the 25th of July. Now, can I think that we are at the good news now? Is it time to announce the good news, Mr. Minister? And if so, well, later on I'll come back. Thank you, Christian. Hello. I'm very pleased to be here. Economically, things are going well in Quebec. The vaccination is going well. And what we're doing today is in order for things to keep going well. So last Friday, Statistics Canada published statistics on unemployment. We have the lowest rate of unemployment in Canada. The whole week, I did some economic announcements that demonstrate that there's a recovery of investments, of private investments. The trust is there. It's extremely positive. Yesterday, we had a wonderful announcement for the aerospace sector in Montreal. All of this economic recovery, this strength depends on the sanitary situation. There is no economic vitality without this security. So it's extremely important that everybody gets vaccinated, and that's the objective of our announcement today. It's an incentive for vaccination. If you still don't have your first dose, there's all sorts of appointments available. There's walk-in clinics. Go with your friends on a Saturday morning, get up, and go get vaccinated. It's very important. Move up your appointments for the second dose. And yes, if you're already vaccinated, you will be eligible for the contest. You will have to consent to participate, of course, so you have to register. I have to thank Lotto Quebec, who will ensure the integrity of the contest in collaboration with the M3S. They're an exceptional partner, so thank you to the people from Lotto Quebec who are welcoming us today. So what do we want to know? How many drawings will there be? The dates of the drawing? So there will be. When it comes to the first dose, so all of those who will have a first dose, who will have received their first dose, and who will have registered, will be eligible to a drawing for the 4 Fridays of August, the 6th, the 13th, the 20th, and the 27th of August. A grand prize will be held on September 3rd. So 5 draws. What are the prizes?
On est vraiment à l'État Québec. On est vraiment.
We're really at Lotto Quebec. This is a big scoop. The total of the prize is $2 million. So for the first dose, every week, a draw. There are 2 categories, 18 and up and 12 to 17. So every week, if you have your first dose, first drawing, the 6th of August, you will be eligible. And if you're 18, $150,000. So 4 times $150,000 for $600,000. The a big drawing, the 3rd of September, for 18 and up. To be eligible for this big draw, 2 doses. It's important to be eligible for the grand prize, $1 million. So $1.6 million in prizes for 18 and up for the 12 to 17-year-olds. Bursaries, study bursaries for the first dose, and these will be, your parents or your tutors will have to consent to your registration. So bursaries of $10,000, 2 bursaries of $10,000 every week. So 4 times 2 times 10 is 80? Yes, sir. All right, thank you. And the grand prize for the second dose for the 12 to 17-year-olds, 16 prizes of $20,000. 16 times 20 plus, maybe plus 1.6, $2 million. So I'll remind you that you must consent, so you must register. But the most important thing, if you are still not vaccinated, go get vaccinated this weekend. I think that is the key message today. That is why we are adding an incentive. There were several measures, incredible efforts for accessibility. It's easy to get a vaccine. You walk to the Palais des Congrès, to the Olympic Stadium. It's easy to get vaccinated. Please get vaccinated. Thank you very much. Thank you, Eric. Thank you. We will now go to the question period for the media. We will start in French.
Nous allons y aller par question et sous-question par média. Alors, micro 1, TVA Nouvelle.
Question. I'm sorry, the question is inaudible.
Bien, je pense que le premier ministre a été...
I think the Premier was very clear yesterday. He said that he was open to looking at things, but it's really a federal decision, and we want to get ready. I think that we've always worked with all of our teams in order to have a plan B. And once again, here, what we are doing, you know, I'm more in a scenario of increase of cases more than in a fourth wave, because it's quite difficult to define. We saw this in the past. But we've got a very clear objective. It's to minimize the hospitalizations if there's an increase in cases. And that is why we are insisting so much on vaccination, because I was giving the example of England, and that's what you're talking about. These increases in cases were astronomical over the past few weeks. We saw it in France as well. But if we're able to limit the impact on hospitalizations, we will win. So I think that it's a bit too soon to talk about the borders right now. But in the meantime, we have around 6 weeks to do the work that Minister Girard just described. So that's what we're concentrating on right now. I'm sorry, the question is inaudible.
Oui. Bien, le travail a été fait par l'équipe des...
The work was done by Eric's team in Lotto Quebec. Go ahead, Eric. We looked at all of the other lotteries that were done, well, mainly in North America and in Canada. It's difficult to isolate the variable and to say the effect is X. But obviously it's an incentive, a positive incentive. And in a fight like this one, every person vaccinated counts. I understand that there's a new approach. People are not automatically registered for this lottery. Wouldn't it be easier to say everybody who's vaccine proof will be registered? Are there rules or laws? Or because I think that it's one more thing to do. We had this debate, And we saw with lotteries that there are lotteries that don't require consent and others do. Now we looked at our options, our legal options, and we preferred to go with consent because you must consent to participate in the contest. And of course, your name will be disclosed if you win. And you must accept this. And so it's a choice that we've made. The two options were possible. Danielle, do you want to comment on this? Because it's important. Yes. Listen, throughout the vaccination campaign, people have made choices. And for us, this notion of consent was very important. But you will see that, yes, it can be an additional step, but it's a simple step. And at the same time, we know that the portal where people will be able to register will be the same portal for the vaccine proof. So once again, it's all linked to vaccination. Talk about the borders again. People who don't have two of the same vaccines, let's say an Astra and a Pfizer, what will we do to organize this? Because now it seems that even in the U.S., they're not super... I'm happy you're asking this question, and Danielle can add to this, but we wrote a very clear letter to the federal government to ask them, because it's up to the federal government to negotiate either with the U.S. or with Europe. So now there's a lot of things that are being said, but nothing has been decided yet. We saw that it changed because a few weeks ago they did not accept an AstraZeneca in New York, and then they changed their minds. But I think I would wait a few days. We've got everything that we need to vaccinate people, but I think it's still a bit too soon to worry about anything. We've asked, I don't know when we're expecting the answer, Danielle? The letters were sent 2 weeks ago. Okay, so we sent a letter to the federal government a couple of weeks ago to ask them to take a clear position. But given that there's a type of delay at the border, I think that all of that goes together. And at some point, we'll have a very clear answer. But if I can add, you know, the science of vaccination is constantly evolving. And we're seeing this. There are changes with the regulatory agencies. So our vaccination calendar, we get our notices and opinions from the immunization committees. We made this decision. We're very confident that people are protected. And now what we have to do is to have our vaccination calendars recognized by other countries. But it's evolving in other countries as well very quickly. So we're not very worried. I'm sorry, the question is inaudible. Are you still concerned about the younger people? Are there other initiatives to target these young people? And will you increase the targets? Because a lot of experts are saying that we need more than 75% in every age group. I'll answer the first part of your question. I think that you saw we adjusted our tools for them. We're going to parks. We did a lot of pop-up clinics, and we've increased the number of walk-ins. Danielle tells us, and the teams tell us, young people do want to go to walk-ins. They want us to be more flexible, so we adjusted. And all of these elements, these actions that we've undertaken over the past few weeks, make it so that the number in 5 categories that was a bit too low was at around 250,000. And now we're at 80,000. Not for 6 categories, but for 3 categories. So things are going well. Do I want it to go faster? Yes, of course. And that is why we are adding additional incentives. So I think that for the question of young people is going well. Now, for the second part of your question, and that's why I said that this was our third objective. Now we're at 82% for the first dose. We're already above our global objective. What I would like, given that the variant, we can see the variant will be there, and we already have some in Quebec in our stats this morning. We went from 5 to 8% with the Delta variant, so we know that it's here. Every percentage more that we reach, that we get, for me it's a winning situation because 1% of our population, of our target population, around 7.5 million, if I remove those below 12 years of age, every percentage is 75,000 people. And so we will settle the situation with our young people. I'm sure that it's going to continue to go well, especially with the incentive. But in addition to this, I'd like us to be at 83%, 84%, and then we're even better equipped in September because the people who come with their first dose, we're told in surveys that they will come for the second dose. So I would say those are the two answers to your question. If I can add, Mr. Girard, you mentioned it. There is room every day. We have vaccination sites in the pharmacies, in our businesses, in the vaccination sites. There's place for walk-ins. There's capacity on Click Santé with appointments. And the good news is that the first doses in all the age groups, we've got some every day. This morning, I was looking at my dashboard, and it was 20 people, 85 and up, who were getting their first dose. So people are still excited about this, and every dose counts in our fight against variant. A question on another topic. We are hearing from a colleague that there's around 6,000 healthcare professionals who are not vaccinated who have to be screened 3 times a week. Sometimes they're compensated because they have to travel somewhere. And this shocks people. People are upset to see this. Do you understand that people are upset? And in light of this, will it push you to think about perhaps changing your position on mandatory vaccination for healthcare professionals? The answer to your question is no, we're not changing our approach because I want to put the numbers in perspective. You're talking about 6,000 people, but we've already got approximately 90% of all of our health employees who are vaccinated. So already, on a voluntary basis, we have reached 90%. France, for example, who wants to make it mandatory, they're at 40%. I can understand at 40% that they're upset, but at 90%, would we like it to be higher? Yes, of course, and I hope that over the next few weeks it'll happen, but our principle has always been that it's got to be on a voluntary basis. Where I think that we need to continue to work even more is on the private side. So intermediary resources, RPAs, we don't yet have the information, and I've asked our teams, given that I think that we've done well with health in general, but in the private sector, we're going to do the same follow-up to make sure that the employees in the RPAs have the same, they've done the same follow-up. But right now we're talking about 6,000 people in a network of 400,000 people. So yes, it's not what we'd like to see, but I think that the more we inform people, and, it's unpleasant to be tested 3 times a week. And, well, listen, it's a good point, but most of the people get tested on site. It's a work colleague who tests them, so they don't have to travel anywhere. But there are some who have to travel because the schedule doesn't fit. But we will continue to do the monitoring that we've done over the past weeks. Can you get closer to the microphone? According to data from the INSPQ, we're hearing that health workers are among the groups of people who hesitate to get vaccinated. How do you explain this? I'm not sure that I understood. Could you repeat it? The INSPQ they had a survey on vaccination, and healthcare workers are among the people who still hesitate to get vaccinated. How do you explain this hesitation on the part of healthcare workers? I don't know what article you're talking about, but I think that the numbers that Mr. Dubé has mentioned in terms of vaccination say the opposite of what you're mentioning, but I didn't see the article that you're talking about. Close to 90% of healthcare network employees have received a first dose. That's good. That's why I would say that we don't feel that there's greater resistance. To the contrary, they've become leaders in vaccination. And I would also say that we'll continue to do the monitoring of this over the summer because I think that we can reach a few more percentage points.
Monsieur Girard avait peut-être
Oui, bien,
Mr. Girard?
je regardais mes notes.
Yes, I was looking at my notes,
Protocole, je vais me poser
and I'm going to break the protocol a little bit, and I'll ask myself a question.
la date limite
The
d'inscription pour le grand tirage.
deadline for registration is the 31st of August, so you must have your second dose before the 31st of August. And
Programmé mathématiquement.
you're all programmed mathematically. You go back 4 weeks. If you don't yet have your first dose,
La date pour être
the deadline to get your first dose and then be eligible for the second dose by the 31st of August
c'est le 31 juillet.
is the 31st of July.
Si vous n'avez pas votre
So if you don't yet have your first dose, go get vaccinated before the 31st of July. And if you want to be eligible for the grand prize for $1 million, get your second dose before the 31st of August.
prochain média.
Hi, Rob Lurie from CTV
Juste
News.
avant qu'on passe en anglais, je veux juste être sûr, est-ce que vous étiez un média francophone?
Non, anglophone.
Parfait, merci beaucoup, allez-y.
I knew that. Hi, Mr. Girard. I just want to know, I was reading some studies about this after an Ohio woman won $1 million in a vaccine lottery. And some of the studies looked deep within the numbers, and they said that there was no increase, that vaccine lotteries don't really work. Do you have any figures to show that this will get the vaccine hesitant to go get vaccinated?
Well, two things on this. First of all, because there are many variables that could stimulate vaccination, it's hard to isolate one variable and say, this is why this person went and got vaccinated. But clearly, by now, we've tried many things, and so we're adding another tool, and so any increase from here beyond what would have been expected normally could be associated with the lottery. And what was the second part of your question? Or do we have?
I just wanted to know if you have any data to suggest that this type of thing works.
Well, we have a general experiment that, in general, monetary incentives do work in all sorts of events in life.
So, if I may just add one thing, we are at the margin here. I mean, that's the reason we decided to wait at the end of the process to make sure that we've done everything else before doing that. That's the first thing. And since you can monitor every day how many new cases we have, how many, and I would think what really pushed us to do this last effort is really the presence of the variants. And this is really important because I repeat, each percentage point is worth 75,000 new people being vaccinated. So is it worth it? I think every penny is worth it at this stage of the game to make sure that we're ready for September 1st.
So I just want to pick up on something you said, and then I have one more follow-up question. You've tried, so, you know, in English we have an expression, there's the carrot approach and the stick approach. A lot of people thought that the vaccine passport system was something of a stick approach. Do you see this as a carrot approach where you're going to, you know, I guess, positively encourage people instead of threatening to take something away?
My minister said it earlier. It's a monetary advantage, and I think what we have, I think, be innovative is not only we do it for adults, but we do it for the kids, and that's the reason we're the first one to go with those purses that for the grants for the 400,000 for the 12 and 17. So I think we're being creative in addressing all segments of the population.
And my other question, no, I just have one other question, which is that the University of Ottawa has announced that students will need to be fully vaccinated to live in their schools' residences as of next fall. Is this a directive that public health here is considering?
No, so far, and again, I'll let the next few weeks advance, because I think our key principle is to go on a voluntary basis. It has worked so far. We will continue this way. I mean, we said everything could be considered at one point, but I think the way we're progressing on being ready doesn't justify to go this way at this time.
Merci. Prochain média.
Hi, Valeria Corey Minocchio, CBC. My first question is about today's announcement. You mentioned in French the goals of doing an initiative like this, and we've been hearing throughout the weeks that the age group 18 to 29 is the one that is lagging behind all the others. I'm wondering if you could speak specifically on how you think this approach will get that specific group to get their first dose or get their second ones as well.
First of all, we believe that this age group are not against the vaccination. They're pro-vaccination, but they don't have the time. So we believe that this initiative will give them just a little push to go ahead and come in to get an appointment to be vaccinated. So this is why we believe it's just an extra. It's a bonus initiative that we believe that will help us to reach our goal with this group age.
And just regarding Minister Dubé, your preface earlier regarding the chronic shortage in emergency rooms in Quebec, could you maybe speak to what your ministry is doing to try and address this issue?
Yeah, sure. Well, I said three things. We know it has been difficult in emergencies, especially in the summer, for many years, even before the pandemic. It's exacerbated by the fact that we had the pandemic, we had a lot of personnel that went away. So the problem is bigger this summer, and we know. But I will keep my promise that we need our staff to rest and go on holiday. So in the meantime, what we're asking Omni practitioners to take more patients, and they should do that now, because that's a problem on the first line that we need to solve. And right now, as a very specific measures, we ask them to make sure that they can take visitors that have symptoms that can be assimilated to COVID-19, but to take them. That's the first thing that we do. We ask them also for the private clinic to take longer hours at night or weekends. So there are many short-term measures that we can take, and we are taking right now to address this issue. So that's the way we're monitoring it right now.
Merci beaucoup. Prochain média.
Est-ce que je pourrais juste peut-être avant, j'écoutais mon collègue.
I was listening to my colleague, and while he's here, I want to take this opportunity to thank all of the companies that have contributed to the vaccination campaign. And I would perhaps, can you address a message on prizes? I'll let you go. I would invite businesses who have helped us in the vaccination campaign. And here I'm going to give you an example. I don't want to make anybody uncomfortable, but there was nothing that would stop us for the grand prize to add other prizes. I'm thinking about a business like Air Canada, for example, who could say, well, perhaps we could draw some trips. I'm giving that example. I don't want to put any pressure on them. But the prizes that we have are prizes that come from Lotto Quebec, and we have to thank them for this. But at the same time, if ever businesses like Air Canada or others want to make prizes available to encourage people, well, we're open to suggestions and offers.
Et moi, je vais donner une précision parce que vous savez.
I'd like to add a detail because, I have the privilege of being the Minister of Finance, Economy and Innovation, but also of Revenue. The prizes are not taxable, so that's extremely important.
Non-taxable.
Non-taxable.
Dan Spector from Global News, just to bring a bit of pessimism to the fold here. What do you guys think of the idea that people who have not been vaccinated by now have made their decision, and this kind of thing is not going to have any effect on them?
We're taking the risk. We've taken many tough decisions in the last year, As I said, I think, and we've seen that with the categories of the younger people, when we adjust to their lifestyle, when we adjust to their demand, it's funny, we have been able to increase when we thought we were blocked at a certain percentage. We've seen that in the last few weeks. So to me, taking another measure as the one we do with this, I think that each half a percentage point, 1 percentage point, those would be 50, 75,000 people that will not generate contacts in the context of the variant. So I think we've proven that we can increase the rate, but I think this effort is another one, right?
And if I may add, every day, every single day, 6,000, 7,000 new person get their first dose. So the campaign is not finished. It's not finished yet.
It's not finished.
But we believe with this initiative, it may increase to 7,000, 8,000, or 9,000 per day.
Well, that's what I was going to ask, actually, is what you project, what the influence of this project will be. Was that it? Like, what is your
well, we have
projections?
an internal bet that we will not share with you.
Yeah, we have a market on this. So
But one thing that I want to tell you, I think we are at 82% today of first dose, which is really good. This is over our objective of 75%. And I'm pleased that we have that because the variants will be there. We know that, and they're progressing every day. So we want to be there. But I would say every additional % will be a win. So that's what I would leave with you.
Merci. Alors, c'est ce qui met fin à la conférence de presse d'aujourd'hui. Merci à tous d'avoir été présents.
Merci beaucoup.
Merci beaucoup.
Merci, l'Auto-Québec. Un gros merci.
Merci beaucoup. Je croirais pas. Il faut que je regarde ça. Vous êtes trop bonne.
Il y avait un appel d'Air Canada.